welcome back to the Skinfluence podcast. I'm Dr. Dustin Portela. I'm your host, and I'm a board-certified dermatologist coming to you today with a laser focus for this episode.
I'm excited to talk about lasers. My name's Austin. I'm a physician assistant here at Dr. Portela's practice. And let's dive into what are lasers and how do we use them?
Lasers have been a revolutionary thing in the field of dermatology, both for medical purposes and for cosmetic purposes. I think most people just think that they're cosmetic, but we treat a lot of medical conditions with lasers as well. And that was, as we'll find out, the original reason that they were developed for human use.
For medical purposes?
Yeah.
I did not know that.
Yeah.
I thought lasers were just in Star Wars before I got into medicine.
I knew we had to get Star Wars reference in here. I definitely, feel like we need sound effects.
I know, we need the pew-pew.
So lasers in dermatology, there's many different types, and the way that I like to explain lasers is that they're sexy but dumb.
Okay.
Because they're big, they're fancy, they do cool things, but a laser usually only does like one thing.
Yeah.
Because the laser is obviously a powerful beam of light of some wavelength, and it hits a target. And whatever that laser is tuned for, it only hits that target.
Gotcha.
So if you have a laser for anti-aging, it's not going to do hair removal.
Right.
It's not like you buy laser and then you can just treat all of the things that we're going to talk about today. And that sucks as a business owner.
I was going to say, that'd be nice.
Because for those listening, to buy a laser for the practice can easily cost a practice owner anywhere between $200,000 to $500,000, depending on what bells and whistles you're getting with it.
Right.
And that's financially not really easy for most small businesses, ours included.
Yeah.
And we do have some lasers that we really like, but I've been very cautious about when we buy them and what we buy, because I never want to be in the position where I've got a laser payment to make, and if I don't recommend this laser to enough people, I'm not going to be able to make that payment. So I tend to save up and try to buy them with cash, so that there's no payment hanging over my head, no deadline, and then the recommendations can be made for people who need that thing, who want that thing, whatever it is.
Yeah, well, that speaks to your high ethics in medicine.
So
because
I certainly try.
Yeah. It's there definitely will be pressure there. It's insane how expensive these things are, and it's sad. There's not one that does all of it. You just change
it's just the physics of it. So we'll start with what's called ablative lasers.
Yeah.
And these were some of the earliest ones developed, not the earliest, but a CO2 laser or an erbium laser.
Yes.
These are ablative, and the reason that they are ablative, and what that means is it actually will vaporize tissue, the top layer of skin. You're going to see something happening in the top layer of skin, because erbium lasers and the traditional CO2 laser is absorbed by water. So that is the target of these lasers. And your cells being like 90% water, when the laser hits it, it's going to make a hole in the skin.
Yeah.
So this is physically removing tissue from the skin when they hit.
Yeah.
If they hit the eye, they're going to give you a corneal abrasion, but they're not going to go back and cause blindness in the retina.
Right.
Because there is so much water between your cornea and the retina that it's going to absorb all that energy before the retina is damaged. But that corneal abrasion is going to hurt.
That's going to hurt, and it's going to heat up.
Yeah.
Have you ever had a corneal abrasion before?
I have had a very mild one.
Yeah.
And they're so painful.
I had a mild one too, and I couldn't sleep all night long. It hurts. So I can't imagine getting a CO2 to the eye. It would not be fun. That would not be fun at all.
Mine did not come from a CO2 laser, so I think I just got some dirt in there.
Yeah, I got bacteria under my contact. So I just posted a video on one of my social media accounts, or on all my social media accounts, about it was a CO2 laser being done, but it looks like the patient wasn't really numb or something. She was squirming around, and just you could tell she was wincing. So, yeah, they're not the most comfortable lasers to do. The ablative laser, well, most of them actually are painful, but ablative really is going to be very irritating to the top layer of skin and painful.
The reason that they're painful is because you have to think that you're kind of like instantly boiling water in the skin, and it's really the heat that it generates that causes the pain. You have nerve receptors in your skin for heat and pressure, and it's that heat that it generates that causes significant amounts of pain. So when you're going through ablative laser treatments, typically you're going to have either topical numbing on the skin, or if the treatment is going to a deeper level, I do nerve blocks on my patients so that their face is totally numb for several hours and that a lot of the heat has dissipated by the time that numbing wears off.
Right.
Ablative lasers can either be fractional or fully ablative. And the way that I like to explain the difference in that, because a lot of people have heard the name fraxel or fractionated. So fractionated is where the laser is split into many different small columns in the treatment area. If you think of the treatment area as a square or a rectangle, as most lasers deliver that energy, it breaks it up into maybe 20, 30 different smaller columns of laser, but leaves normal skin in between those columns. And it's like aerating the lawn. If you've ever seen a lawn after it's been aerated, you have those little plugs and there's, millions of little holes throughout the grass. That's what a fractionated ablative laser does. And it allows for really good results, but faster healing because we have normal skin in between that can, take the stem cells and can heal those other adjacent areas of thermal damage much quicker. Whereas a fully ablative laser leaves no room between the column of laser. And so that laser is more like mowing the grass. You're taking everything off the top. And if you turn the laser to a higher power, it's going to cut the grass shorter. And you can make these strong enough, especially if you do more than one pass in an area, to where you're not just cutting the grass, you're removing the sod. You're getting down into the dermis. And the results from that in the right hands can be incredible, but the downtime can be significant. You have to think about if you were to remove sod, how long is it going to take for grass to grow back there? And that's the way that it is with their skin.
Yeah. You can expect with the fully ablative a lot of blistering, oozing, things like that, where the fractionated lasers are going to leave more of a... It'll look more charred, but it's not going to be as completely blistered, removed.
It'll have a little sandpaper feel on the skin, and then depending on the depth, you may still have some oozing and some swelling. Yeah. So then we get into non-ablative lasers.
Yeah. So non-ablative lasers are just like we explained. Ablative lasers they'll affect the barrier, the top layer of skin, whereas non-ablative lasers are going to work at a deeper level. They're not going to destroy or damage too much the top layer of skin, the barrier, but they do work to help. They use heat, just like this is using heat to stimulate collagen production. You may not get the total anti-aging effect with the non-ablative as you will with the ablative lasers, but they work underneath the skin rather than just completely through the skin, which is typically how I explain that to my patients. A little less downtime than with the ablative lasers, but there's still going to be some downtime. You're going to feel like you got a bad sunburn. You're going to be red, and there's going to be maybe a little bit of downtime depending on how sensitive you are, but good benefits with that one as well, whereas we use ablative to really help with the superficial lines, wrinkles, texture of the skin. And this is more collagen stimulation and production underneath the skin to help plump and even skin texture and things like that.
A non-ablative laser passes through the epidermis. The laser energy is tuned, and it's not a CO2, it's not an erbium laser. These are different wavelengths where the target in the skin is deeper. So it passes through the top layer of skin. You're not going to notice little holes on the skin. And then that's where the damage. But if you take a biopsy of that area, you can see a zone of thermal damage that looks very similar to what a CO2 would do, but the top layer of skin is spared. So you can get back in makeup quicker with these because you don't have little channels in the skin where product would get down in there. So also, just like you explained, great results, less downtime, but results may not be quite on par, at least for fine lines, wrinkles, deep lines, as the ablative lasers.
Totally. Next up, we have the pulse dye lasers. What's a pulse dye laser?
A pulse dye laser comes in at a wavelength of about 532 nanometers, and this targets hemoglobin. So this is the laser that you want for red spots in the skin, little blood vessels, because it's not going to leave a hole in the skin. It's not targeting water. But as it goes in, if we target little blood vessels in the skin or that background redness, it heats up the hemoglobin in individual red blood cells to the point those red blood cells blow up. That heat causes damage to the blood vessel lining, and the blood vessel collapses and goes away.
Right.
So pulse dye lasers are excellent for vascular lesions, but the laser has to be able to see them really well, meaning these work best when you have blood vessels on fair skin, because there's nothing else that the laser is going to see other than that hemoglobin.
Right.
If you have a darker skin type and you want to treat blood vessels in the skin, we have to go up to what's called a Q-switch laser. And this is a doubled energy from the 532 to a 1064. And these are called ND-YAG lasers.
Yep.
ND-YAG lasers are much safer when you are treating darker pigmented skin types, or if the blood vessel is much deeper in the skin. So some people have those deep blue veins around the eyes. These can be targeted with a pulse, with an ND-YAG laser.
Yeah.
So it's a little bit different of a wavelength. The energy travels a little deeper, and it does not target melanin in the skin in the same way. Whereas a pulse dye laser in that wavelength can have some impact on melanin. And you don't want to take away the melanin from somebody who has more melanated skin.
Totally. When people hear IPL or BBL,
Yes.
that's kind of what we're talking about with the pulse dye.
So it's similar, but this is, many people have had an IPL treatment, intense pulse light, or a BBL treatment, which is broadband light. It's very similar. Cyton would argue with me because they own the trademark for BBL, and they would say BBL is not the same as IPL. But for all intents and purposes, from a consumer, the concept is similar.
Right.
These are not lasers. Broadband light or intense pulse light does not use a single wavelength of energy the way that a laser does. So a laser is 532 nanometers, 1064 nanometers, 10,600 nanometers, 2940.
Yep.
Broadband light might use wavelengths anywhere between 400 nanometers up to 11,000 nanometers. And so we're encompassing a broad range that might be hitting pigment in the skin. It might be hitting blood vessels in the skin.
Yeah.
And so these lasers also are, or I say lasers, but again, they're not true lasers.
Yeah.
They deliver energy in the same way that lasers does in individual pulses, but they're going to target everything within that wavelength, and so they're on for a lot longer period of time as well. So for tattoo removal, when we're using a tattoo removal laser, nowadays most good tattoo removal lasers are only delivering that energy within like 450 picoseconds.
Yeah.
And so we call these pico lasers. And when you deliver all of the energy in such a short period of time, you generate less heat in the skin.
Totally.
So there's less damage. I have seen people online who went to get laser tattoo removal or hair removal with a BBL or an IPL, and these are on for milliseconds.
Yes.
And it generates so much more heat that people get scarred if they have richly melanated skin.
Sure.
Because they're not just getting the hair removal wavelengths or the red blood vessel removal wavelengths. They're also getting the same wavelengths that will target melanin in the skin. And so if you have richly melanated skin, a darker skin type, and you are getting IPL treatments or BBL treatments, it can be very dangerous. It can risk scarring and permanent depigmentation of your skin.
Yeah. So things to be aware of if you have a little bit darker skin when you're looking at lasers. You want to be making sure they're using the right one on you.
And that's part of why we always recommend that when you're getting these treatments done, seek out a board-certified dermatologist.
Totally.
Because these laser companies, many of them are great, and I don't want to disparage them, but some of these laser companies or the reps that work for them are willing to sell the device to anybody that can afford it, that has the minimum licensure, and it doesn't have to be a physician.
Yeah.
In some states, it can be a nurse that can buy these. If they have a nurse practitioner overseeing them, they can be PAs, they can be nurse practitioners. And if they only got training from the laser company and they haven't gone to courses and they haven't been supervised in delivering treatments and learned the risks, that's where people go to a med spa that just bought a new laser. They've got a big payment and they're doing laser hair removal on dark skin types with an IPL device, and they're burning people.
Totally.
So it's definitely worth doing your research before you go have any laser treatment done to make sure they know what they're doing.
Yeah. It's very important to understand what you're looking for as a consumer, but to make sure that the people that you're going to are, you can trust them.
Yeah.
and their opinion.
We also have diode and Alexandrite lasers, and these are just different mediums that the energy is passed through. So every kid in elementary school does the experiment. You shine a flashlight through the prism, and you see the wavelength of light come out in a rainbow, right? Because it splits that up. So when we have these laser companies, the physicists that work there, they make these lasers, and they're essentially taking that light energy and passing it through a medium. When we say it's a CO2 laser, they're passing it through a chamber of CO2 gas, and the only wavelength that makes it out of there is going to be 10,600 nanometers. Or erbium, they're passing it through erbium. Through a diode, a little bit different there. Through Alexandrite, they're passing it through Alexandrite. And the only wavelength that comes out in diode and Alexandrite are typically going to be treating melanin or dark pigment in the skin. And so these are the most commonly used lasers for dark spots on the skin and for laser hair removal.
Right. So going into laser hair removal, how does laser hair removal work?
Laser hair removal is going to work best when you have dark hair on fair skin. Because again, lasers, they're sexy but dumb. So they only know what they're programmed to target. And for ruby, for Alexandrite and diode lasers, they're primarily targeting melanin. So they want dark, brown, or black pigment. And if you have a dark hair, they're going down to the bulb of that hair follicle, and they're causing thermal damage to where that hair follicle then is damaged enough that it doesn't grow hair. Now, you can go through a series of laser hair removal treatments, and maybe 3 or 4 years later, some of those hairs will finally recover enough that you start getting some hair back. It's not as dense as it was before you started treatment, but it can start to grow some hair, and you might need touch-up treatments on occasion. But if you have dark skin and dark hair, the laser doesn't know the difference between melanin in the hair follicle and melanin in the skin, and it will just target all of it.
So you have to be really careful about that. I like the analogy of it's a dumb, smart but dumb. Because it's targeting just the one thing.
And if you have blonde hair or gray hair or white hair, there's not really a target for the laser to hit. So unfortunately, if you have, as a guy, a back full of silver hair, like you're a silverback gorilla, laser hair removal is just not going to work that well on you. I have some female patients who come in and they're starting to get little peach fuzzies on the face, and they ask me, can I get laser hair removal on this? And I ask them, are they coarse dark hairs? And usually the answer is no. They have like the occasional one, and they say, well, it's not going to work for you. I wouldn't waste your time and money. So have you had laser hair removal done before? I had IPL done to do laser hair removal, because IPL encompasses those wavelengths that we use for laser hair removal. And so they can be effective for that, but they're not as effective as a dedicated hair removal laser. So when I was in residency, the esthetician did IPL on my neck to get rid of the neck hair. And I went through 2 or 3 treatments, and really I needed like 6 treatments probably. And I got some reduction. I had to shave less on my neck. But now I'm, 8-9 years out from that, and everything has recovered.
Everything's come back. I've had it done my back and chest. I'm not like the hairiest guy, but enough to where it's like, let's try this. And it does hurt a little bit. It's not the most comfortable. We call it spicy, I guess, is the word we use, where it stings a little bit. But there's not a lot of downtime with it. It's very tolerable as a certified wimp when it comes to pain. I could tolerate it, and not a lot of downtime. So laser hair removal is a great option for people who have the dark, coarse hairs, lighter skin, and there's not a lot of pain associated. I don't do any topical numbing or anything like that. But and then I go on my way, and it's totally fine.
If you do have a darker skin type and you want laser hair removal, that's where the ND-YAG laser can be effective. It's more effective at targeting the deeper areas, because the energy passes deeper in the skin before it gets to the target. So it will bypass some of the melanin in the skin before it gets to the hair follicle, which is going to be deeper than the hair bulb is down in your dermis. So that's safer for darker skin types, but not necessarily for everyone. So again, good experienced practitioner is ideal.
And lasers are getting better and better, and they're able to treat darker skin tones nowadays, as opposed to when they first started. It was A
only
strict
fair
no.
skin. Yeah. So,
All right. Well, let's move into our Did You Know segment.
okay.
Well, you probably did know this as a board-certified dermatologist, but the word laser is actually an acronym which describes what is happening with these machines. And so laser stands for light amplification by stimulated emissions of radiation.
Yeah. I think that's a cool fun fact.
I
It
think
kind of
it's cool,
reminds
too.
me of scuba. Like scuba is an acronym.
Yeah.
Self-contained underwater breathing apparatus.
Yeah.
It's just what it does.
And we developed that, we just turned it into a word, and that's what we use.
And it's such a cool word.
Laser is a cool word.
Yeah, I want sharks with laser beams.
It's a fun word.
So, well, the first lasers that were developed for medical use, particularly in dermatology, plastic surgery, were developed to help remove birthmarks.
Oh, really?
So they were likely the pulse dye lasers to remove hemangiomas, again,
Yeah.
because they target the hemoglobin in the blood.
Totally.
So when people have, these babies are born with these big hemangiomas, especially the ones that are not going to involute and go away on their own, they can be lasered to help get rid of some of that.
Interesting.
So that was kind of the original application. CO2 lasers came along shortly afterwards,
Yeah.
and they were fully ablative when they first came out.
Oh, I bet they
were
were.
intense. When I was in residency, our program director at one office still had, an early CO2 laser from like the 80s, because these things are very robust.
Yeah, I bet they're built to last.
They're kind of like washing machines.
Yeah.
If a washing machine was built in the 60s, 70s, 80s, it's probably still running. Whereas like if my dryer's going out that I bought 5 years ago.
Oh,
So
yeah.
the new lasers definitely are more finicky, but this old CO2 laser was a dinosaur. There's an oculoplastic surgeon in town who's had a CO2 laser for 20 plus years, and it's
No
still
kidding.
working.
That's
So,
wild. It's like when you go to grandma's house and her
Yeah.
microwave from the 70s
Yeah.
still kicking.
yeah. So they just don't make them like they used to.
They just don't.
They cost so much more.
Oh,
So-
I bet.
So let's move into kind of from the patient side. Now you understand a little bit about what lasers are, what they can do, what they can treat. So how do you prepare yourself for a laser treatment as a patient,
Right.
and knowing what to ask for?
Yeah, well, it definitely depends on what you're going in for, but typically because it is light amplification, you don't want to be on any medications that make you sensitive to light. So being really careful about that, understanding what the goal is that you're trying to achieve, and then making sure, doing your research as a patient, that the clinic or wherever you're going has the right equipment. Fortunately, we have ChatGPT nowadays, so if you have any questions about the machines that they have, they're all listed on most people's websites,
Yeah.
what they have, and you can just throw it into chat and say, what is this doing? What are this? And it'll go over everything for you. But typically, we want to make sure you're not on any medications that make you sensitive to the sun. We want to make sure there are no contraindications. So if there's anything that is in your skin or under the skin that could heat up and cause issues, metal, things like that, piercings. Sometimes you have to be careful about going over piercings. And then a lot of times when you go in for lasers, you're going to be on medications to help calm you down or to help with pain, and to make sure you're not allergic or there's any contraindications there.
Yeah.
But
Most of the time when people are seeking laser treatments, they're seeking them on the face. And especially if we're targeting brown spots, it's very important not to be tan when you come in.
that's very true.
So we do way more laser treatments in the office over the fall and the winter than we do in the summer. Because if you come in and you want to get rid of brown spots, but you have a background tan, the laser doesn't know the difference.
Yeah.
And now you've got all this extra melanin in the skin, you're much more likely to burn. So if you want a laser treatment any time of year, don't be tan.
And we even don't recommend spray tans or fake tans.
Right. Again, it's a color in the skin that the laser can see.
Yep.
And that could generate extra heat in the skin. So
Totally.
as pale as you can be before you get a laser treatment. And that really doesn't matter what laser treatment it is,
Yeah, totally.
even if it's not necessarily targeting melanin.
So this is the time it's okay to be pale.
It's okay to be pale. It always is.
Yeah. So what does recovery look like for a laser treatment?
So it depends on the laser. Again, if you are getting an ablative laser, the downtime is going to be more significant because we're making holes in the skin that have to heal. And when I do fully ablative CO2 laser resurfacing or fractional CO2 laser resurfacing in the clinic, I tell the patients, I want you to text me pictures every day. I give them my cell phone number because they wake up the next morning and their face is twice as big because they're so swollen.
Super
Because it's
swollen.
an injury, right? Like spraining your ankle. And then they can often have oozing. We're going down deep enough that there's blood vessels next door. We can open up blood vessels and they can get some scabs that will appear on the skin. And so depending on the depth and the aggressiveness that we set the CO2 laser, they may have up to 2 weeks of downtime where they don't want to be in makeup. They don't want to be doing public appearances. And if we take that CO2 laser down to a cool peel setting, which we have the Helix laser from Cartessa, that one has 1 to 2 days of downtime, even though it's CO2, because we're just not going down deep into the dermis.
Right.
We're staying in the epidermis. If you're getting IPL, BBL, you're going to feel kind of a little red sunburn feel, but you can generally wear makeup the next day because we're not puncturing the top layer of skin. So it really varies. So that's always a question to ask before you have a laser treatment, preferably in your consultation, because you don't want to walk in there and be like, oh, I have to go on a business trip next Tuesday. And they're like, well, your face is going to be oozing for a week.
Yep.
So know that before you schedule the appointment as to what the downtime looks like.
Yeah. And for most lasers, no matter which one you're getting, I will always recommend sun avoidance afterwards as well as part of your recovery. It's just don't go out in the sun. If you have to be out in the sun, you cover up with a nice thick mineral sunscreen preferably.
Sun protection before the laser and after the laser is important.
Yeah.
Because you don't want post-inflammatory hyperpigmentation. The sun gets that, it's going to stick around longer. We really want to try to control all the variables that we can to get the patient a quick recovery and deliver the results that they want.
Right.
And one of the ways we do that in our clinic is we provide patients all of the aftercare that they need on aggressive lasers.
Right.
So we just build it into the price where I'm going to give you every product I want you to use. We give you an outline of here's what you're going to use on day 1 and day 2 and day 3 and day 4. Here's when you can probably go back into makeup. And especially if patients are sending me pictures, then I can say, yep, this is what we need today, and kind of hold their hand through that process. And that's really important to me because I want somebody who's spending a fair amount of money to get a laser treatment done to feel well taken care of, to be well taken care of, and to get the results that they're looking for.
Yeah. And doing the laser is just half of the equation because if you're not recovering well or doing things that are going to help your skin heal, you're not going to get as good of results.
Right.
You're going to get hyperpigmentation. You'll get maybe some scarring depending on the type of laser that you do. So like you had mentioned, you provide them a lot of products. Typically, sometimes I've seen some posts online where they post a picture of their face. They say, day after my CO2 or whatever laser, and their skin is just dry and scabbed. And maybe they're just taking that for the picture, but they should be putting on lots of different, even just slathering in Vaseline, something to help that barrier repair.
You want the barrier repair. And that's why we've talked about it before. We often recommend Dr. Rogers Restore.
Totally.
As my favorite post-laser product for ablative lasers in particular.
It stays on nicely.
Yeah. There's a fun thing that I learned in residency. In one of the adjacent residency programs, a paper was presented where, like, did you know that if you use minoxidil, like Rogaine, before laser hair removal, you get better results?
I have not heard that.
So usually you should start using it 2 or 3 months before on the area that you're going to have treated. And then it's going to get more of those hair follicles. Because you have some hair follicles when you go in for laser hair removal that are going to be in the resting phase. There's not going to be a hair follicle
so
there.
You want as many in anagen phase.
And so you want as many to be in that anagen growing phase as possible. So if you start using minoxidil before laser hair removal, it's going to help get all of those follicles into the growing phase at the same time. So you may be able to have fewer laser treatments and get more results with each treatment if you're using minoxidil, which sounds counterintuitive. Like, I want my hair to go away, so I'm going to put on a product that makes the hair grow.
Yeah.
But you don't continue it after you finish the series, obviously.
Yeah.
But in preparation for laser hair removal, minoxidil might be helpful.
I can see the merit in that, actually. That's very interesting.
So it's kind of a fun thing.
Yeah.
We've talked about, safety if you have darker skin tones, but cost is something everybody wants to know when it comes to lasers.
Cost, and they're not cheap.
No.
It's not something that people just throw around flippantly or do all the time. They can be very costly depending on the type that you do. So that is something to prepare for as well when you're going into, is understanding that you're going to be spending a little bit of money on this procedure. But if the benefits outweigh the cost, then yeah, then it's worth it.
Right. So a non-ablative laser, something very low downtime, might be, anywhere between $300 to $800 per treatment. If you're doing fully ablative resurfacing or full, fractional resurfacing that's aggressive, it's not uncommon, depending on the area of the country that you're in, to spend $2,000 to $5,000 for that treatment. And this is where it's really important as a patient to understand the expectations. Yeah. And really, you can grill your provider on, what is this going to do for me? What kind of results can I expect? And of course, there's variation in that, and we can't guarantee any specific result. But I know that I can get a patient to a certain point. And if we don't, this is just the way that I practice. If we don't get a patient where they wanted to be with a treatment and I did everything right, I often will, and the patient did everything right. They didn't go like, sleep in the desert for the next week and get their skin all messed up, then, it's not uncommon that I might offer a touch-up and say, hey, I want to make sure we get you where you want. I want you to continue to trust me. Your outcome is just important to me as it is to you. Right. And so that's just the way that I like to practice. But the lasers are expensive to buy, and so they're expensive to use. Yep. And the other thing that a lot of people don't understand is the industry of the laser companies, that they'll sell you a laser and then they'll want another $12,000 a year for your warranty. So that if something breaks, which it will,
and they typically do frequently,
then they have to come back in and fix it. And so they want you to keep up on the warranty. And so there's a lot of costs associated with owning and operating a laser. Yeah. And if I'm doing something and I give patients 24/7 access to my cell phone, that's also something that I want to be compensated for if I'm getting pulled away from my kids, my wife. And so there's a lot of factors that go into it. Laser treatments are not necessarily something that you group on. You don't want to go to the cheapest place. And in the hands of a board-certified dermatologist or a board-certified plastic surgeon, I think are the best places to get laser treatments. Yeah.
And on top of that, you have office staff that gets factored into the pay of you have a patient coming in, they're checking in, they're often seeing a medical assistant or someone beforehand, or if an esthetician or someone who's being supervised by a provider is doing the laser, then there's a lot of different costs that go into having a laser, using a laser, and doing that. So,
well, we hope that this has answered all of your questions about lasers.
Yeah, and if you have more questions, let us know.
Yeah, shoot us a message at Skinfluence_pod on Instagram. We both monitor that account, and we'd love to get your questions. Tag us in photos when you're listening to the podcast. Let us know what you're enjoying. Our product of the week this week is our Summer Essentials. This is on the Air Health Skin Store. So the Air Health Skin Store is a place where it's free to make an account, and they're dermatologist negotiated discounts for the skincare products that you're already buying every day. So in the Summer Essentials basket, to help you protect your skin if you're getting ready for a laser treatment or you're completing a laser treatment, we've got HelioCare. This is an oral supplement that helps protect your skin from the sun. And we've got several high-quality sunscreens that you can choose from, including Elta MD at a discount, as well as gentle cleansers and moisturizers. So check out the Summer Essentials basket on the Air Skin Store. We'll have that link down in the podcast show notes and on YouTube in the video description.
That's a great deal.
Once again, I'm Dr. Dustin Portela, your host. You can find me on all social media platforms at Dr. Dustin Portela.
And I'm Austin Lee. You can find me on social media on Instagram, TikTok, and YouTube at Austin Lee PAC.
Leave us a 5-star review wherever you listen to podcasts. Share the episode with a friend, and we'll see you next time.